when they're pushing all the remaining fluid out of the lungs. We can have leftover fluid in the lungs, and those babies have a much higher rate of being asthmatic, actually. That's the short answer.
What about for the mom?
For the mom, it's the difference between going through major abdominal surgery and going through a natural process that God designed. So, huge difference for the mom. Recovery is much quicker with a natural birth. Yes?
What's the difference between the shortest time it takes to give birth and the longest time, and is it a matter of nutrition and fluid retention, for lack of a better term, how well hydrated the woman is before she goes into labor? Do any of those have anything to do with it?
Okay, the question is about the difference between length of time of labor and what affects it, whether it's hydration or nutrition. There can be a lot of factors that affect that. Typically, a first birth goes slower than a subsequent birth because it's the first time the mother and baby have done this. The next biggest factor that relates to this is actually directly related to what I do as a chiropractor when I work with these moms and babies. It has to do with the structure of the pelvis. If the mom has been through trauma, thrown from a horse, falling on the ice, car accidents are the biggest ones we see, and there, remember in the video we saw that torsion of the pelvis and how that changed the shape of the opening from a more heart-shaped or generally a circle to it put lots of corners in it. If there is not enough room for the baby to actually descend down through the birth canal, or if by also when the pelvis gets into that distortion, then the different joints, the pubic bone and then the SI joints, which is where the sacrum joins with the ilium, if those joints are not moving properly so that they can't go through the expansion and accommodate the changes that the mother and the baby and the muscles need to do, that will drastically slow down labor. So by keeping a mom well adjusted, keeping the bones in the proper alignment and with the proper motion that they're supposed to have, that is a major piece in speeding up labor. Nutrition will affect more biochemical things. And so obviously with the whole health of the mom and the baby and how all of that works and fits together. But that's the moms that are under chiropractic care usually have pretty quick labors. Yeah, did you another half?
Also the hydration. You hear about these women that have 24-hour labors, and then somebody else is done in 5, 6 hours, something like that.
Some of that can depend. If a mom has a home labor, there's no reason why she can't continue to take in fluids. I know at the hospital they often discourage that, but so that can depend on your birth choices as well. Other questions? Yes?
How do you deal with a breech birth?
How do I deal with it? Or
We saw the perfect scenario, but we had 3 that were totally imperfect scenarios.
okay. Typically with a breech birth, the first thing we would want to do is make sure that the mother's pelvis, because as you saw, if things are not aligned properly, the baby will not be in the right position. The Webster technique that they mentioned actually is a technique that we have learned through our chiropractic classes and through, actually I forgot to mention, this video was made by Dr. Carol Phillips, who is the one who has taught me most of what I know about pregnancy and childbirth from a chiropractic perspective and dealing with all of these different factors. So that typically a breech birth is because the mother's pelvis is not in the right position, and so the baby cannot get in the right position. When we get the mom adjusted, we have seen the babies turn, even as far as the 8th month. Now, if that doesn't work, there can be a few other scenarios. The baby could be tangled up in the cord to a point where they can't turn back into the right position. There could be an extremely short cord, or the placenta could be in the wrong place such that the baby can't get in the right position. So in those scenarios, if the baby will not turn, Dr. Carol Phillips, who was a breech baby herself and suffered a lot of health problems as a result of that, has actually said that it is more difficult for the baby to go through labor in the breech position, that if the baby won't turn, a C-section might need to be necessary in that situation. So it isn't always perfect. So then we make do with the best we can, and then we work with the mom and the baby afterward to help them recover. Yes?
What are the effects of inducing labor and also by administering an epidural?
Okay, the question was, what are the effects of inducing labor or of an epidural? Or both. When you induce labor, if the baby is not ready and the mother is not ready, usually that means that the baby is not down low enough that they haven't stimulated the contractions on their cervix yet. Sometimes there's been a miscalculation in the due date and the baby is actually early. That's the induction, the Pitocin that they give to the moms causes much harder, much stronger contractions than what she would normally have. And so then that segues right into your second question of what about an epidural, because then we have artificially induced contractions instead of the ones that the mother would actually have. Let me just